Hi, good night, everyone. Good night, Dr. Jonathan Sookbir. Right? How are you going? Everything
Good
okay?
night.
How's COVID treating you?
Now how we're treating me is how we're treating everybody, right?
Exactly, yes. Could you give us a little description about yourself? Talk to us about yourself. Give us a little brief, background about you. And which area
Okay.
you're representing as well.
Okay, well, my name is Dr. Jonathan Sookbir. I born and grew up in Cedros, in the community of Cedros. I am a resident of emergency medicine, literally at the forefront of the pandemic battle, um, at the San Fernando General Hospital, and we serve the Southwest Regional Health Authority, the largest catchment area in Trinidad and Tobago presently. Um, I've been a doctor since 2016. Um, Went through internship, house officer years, and now I'm doing my postgraduate degree in emergency medicine because that's my calling, I think, and I feel like, and that's what I feel strongly about. That's pretty much a little bit in a nutshell about myself. Um, Sometimes in the emergency department, I am a acting registrar, which is one of the more senior doctors in the department at a given time.
Okay, nice. Nice, nice. Just a moment. Let me just fix this. Awesome. So, COVID-19 has come and struck the nation as well as the rest of the world in a kind of untimely manner, unexpectedly. Can you tell us a little bit about COVID-19? Or what do you know about COVID-19
Well,
as a doctor
well, sure,
from
sure, no problem.
your
Uh,
perspective?
so COVID-19 is really a description or is the term that is used to describe the effects of the SARS-CoV virus. COVID-19 is really a syndrome of a severe type of pneumonia, or ranging from a bad severe pneumonia to a milder upper respiratory tract infection. It is really an inflammatory infectious response to the SARS-CoV-2 virus of the upper respiratory tract as well as your lower respiratory tract, to that particular type of virus, right? Now, the SARS-CoV-2 virus, which we call the COVID-19 virus or the coronavirus, is not a
Yeah.
new virus. It's actually been around. Coronaviruses have been around quite a while. Um, there was a pandemic called the SARS pandemic, the
Mhm.
SARS epidemic. That was also due to a coronavirus. Even MERS, Middle Eastern Respiratory Syndrome, um, also was a coronavirus. So SARS-CoV-2, the name alone suggests that it's not something new. While it is a new form of virus, where its appearance is a little different from its predecessors, right? It's nothing new to coronaviruses is not a new type of viruses. It's not a
Mhm.
new type of virus in our community at
Mhm.
present, all right? Um, but it seems like these viruses have an affinity for
Mhm.
um, respiratory tract tissues, essentially, hence causing a bad pneumonia, upper respiratory tract infection, let's say a sore throat, right, a runny nose, a cough, a cold, stuff like that.
Okay, okay. So those are some of the signs and symptoms, but it's been around a long, long time now.
Yeah, it has been around a long time. It's just a new strain.
That's
It's just
true.
a new type of virus,
So
really.
it's like how every couple of years have a different type of cold, or every few months have a new cold coming out with different symptoms and stuff like that, getting
Yeah,
stronger and stronger.
yeah, yeah.
Okay,
And it seems like these viruses are pretty much adapting to to the environment.
that's
Um,
scary.
yeah, viruses for some persons believe, some scientists believe that viruses are living entities, and some
Mhm.
scientists believe that they're not. and they really don't have all the function of a living organism. They need so far the best definition of them are particles. They need a living host to survive. And so when these viruses are exposed to cells that are alive and carry out living functions, they hijack our cells essentially to make more of themselves and hence trigger an inflammatory cascade and an infectious response, which is what we see in patients right now.
And like you're saying all this, but who's more likely to contract the virus? Like more likely.
Well, actually, previously taught in the first and second wave that it was more those of adult origin,
Mm-hmm.
those in the ages of 30 and 30 and onwards, and the at-risk population would have seemed to have been those who had hypertension, diabetes, heart disease, smokers, lung diseases, right? Pretty much those persons with comorbidities. But now, in this particular wave, it seems like it's a little more aggressive. Even younger persons without any comorbidities, we're seeing they're developing severe pneumonia, and it
Oh.
seems like as um, the epidemiologist would have pointed out in the Prime Minister's conference previously,
Mm.
the concerning thing is that it's happening in younger persons now, and younger persons are dying. And they seem to have had no history of any comorbidities like diabetes, asthma, pressure, sugar, heart disease, etc. Right? And that seems to be the concerning thing about this particular wave. And what we have noticed is that younger persons between the ages of 30 and 50 with little or no comorbidities, with the exception of them being a little bit overweight, increased body mass index being the only thing really, they develop some really bad pneumonias and need ventilators to support their respiratory function, such as breathing and oxygenating, right?
Mm.
Getting carbon dioxide out and getting oxygen in.
Oh. That's crazy what going on right now. I don't know.
Yeah.
Like I see they're developing the vaccines and stuff like that. But what are your views on the vaccines that are
I
currently
think
out? And
I
would you
think
advise persons to go and get it?
I will definitely advise persons to get the vaccines because vaccines, first to begin with,
Mhm.
vaccine will not stop you from getting COVID-19. They will not prevent you from acquiring the coronavirus. What they will do, though, is reduce the disease burden of the coronavirus that will require you being on a ventilator or even hospitalized and needing oxygen support. So, what the vaccine does, it dampens the effect of the coronavirus, so much so that it may just seem to you like a little flu or a cold that you could deal with at home and without
Mm.
getting severely ill that you need to come to the hospital for. Vaccines also protect the population that are unable to really receive vaccines, such as the immunocompromised. What do I mean by that? I mean those who have HIV/AIDS, those who are on chemotherapy for cancer treatment, the elderly and frail persons who are bedridden and bedbound, and even children, right? So
Mm.
it really protects that vulnerable population. And more importantly, it reduces hospitalization. There's vaccines do not kill coronavirus. It doesn't stop coronavirus. It doesn't eradicate it. What stops coronavirus, what eradicates coronavirus, is proper masking, proper hand hygiene, proper physical distancing. And note that I emphasize proper. Persons are wearing masks, but their
Mhm.
nose are not covered. Persons are,
Yeah.
when they're wearing the mask, they hold and they're talking to you, they're holding the mask underneath, like if you want to see them speak, right?
Exactly.
Proper hand hygiene is that persons are not properly washing their hand with soap and water for at least 40 seconds, not hand sanitizing for at least 20 to 30 seconds, not physical distancing more than 6 feet away. All right. So those are some of the things that will prevent the transmission and you acquiring COVID virus. While vaccines dampen the effect of COVID 19, physical distancing and your public health regulations are there to really prevent you from acquiring the virus.
Prevention better than cure, obviously, always. That's good. So let's say, all right, you sold me on the vaccine, and let's say I go and get it tomorrow morning or whenever. Or what can I experience within the first 24 to 48 hours of taking that vaccine?
Right. So, interestingly, I had a presentation like this over the weekend, and some of the symptoms that one can experience are headaches, nausea, body aches, chills. Some may get a little low grade fever, and most definitely pain and soreness to the site where you were injected. Some get a little blurry vision in terms of runny eyes, a little stuffy nose. But really and truly, at the end of the day, sometimes the symptoms vary from person to person. At least 70 to 80% of persons will experience symptoms, whereas the remaining experience no symptoms. Like when I got the vaccine, I didn't get any symptoms at all. All right, so it really depends upon the individual. And it's difficult to say who's going to get symptoms and not going to get symptoms. But the simple symptoms to look out for are those which I have mentioned before.
That's really awesome. And due to the pandemic and the breakout of what is currently going around across the world, doctors as well as all types of health staff in that medical field have been called out. How has this affected your job in that way? Like, do you have to do extra time? Do you have to,
Well, I mean, we
stay
don't.
back? All these type of things. Work double?
Well, you have to work extra hard because now, when I work in the emergency department, we are pretty much not at the front line, but we are at the battle line, essentially. We are at where the war zone is the hottest, right? These are where the sickest patients come in for testing, for evaluation. So what the Ministry of Health had advised the regional health authorities to do was to create what we call a parallel healthcare system. Now, this parallel healthcare system is designed to protect those who do not have COVID symptoms but have medical emergencies. For example, if a patient is having a heart attack or a stroke, right? If a patient is having a heart attack or a stroke, they can still come to the emergency department and get treatment that does not involve them mingling with patients with other who have COVID or who are suspected of having COVID or having viral type symptoms. And that is the beauty of a parallel healthcare system. Now, this parallel healthcare system starts with the emergency department. And that makes it challenging because we now have to cover both the non-viral pathway or the non-pandemic pathway and the pandemic pathway. And it involves two different type of patients, and two different types of personal protective equipment and two different types of approach to patients and what those patients would need in each pathway. To be honest, the last 10 days to 14 days have been really, really challenging in all emergency departments, not only for doctors, not only for nurses, but for our laboratory technicians, for our radiographer techs, for our cleaning and laundromat personnel, especially for our EMTs. I mean, nobody speaks of it. A lot of persons speaks about doctors and nurses and stuff, but the GMRT personnel have been doing an awesome job. Really, they are the ones who have to respond to both the parallel pathway that I described earlier and the non-parallel pathway. They have to take patients who are COVID positive to a COVID facility, as well as take patients who are non-COVID to the emergency department, right? And they are swamped with work because they are the only ambulance service that are medically trained to transport these patients, not only to Swara, but all over the country. So they are really overwhelmed. And while we do a lot of work as well, they are equally as important. Because if we have patients in our department and they can't move to another department, then other patients can't come to us. And that transition between the parallel system to within the parallel system has to be done by an ambulance service. And I must say kudos to the paramedics and stuff. They have done an amazing job.
Yeah.
I mean,
A whole structure.
everyone, doctors, nurses, everybody has been doing their part, but they are ones that are usually very much forgotten. And I must say that they do a great job because without them, we can't get transport to get patients out of the hospital to Coover facility or to Augustus Long facility or Cora facility. Right?
It's really awesome.
So you have a whole set of medical personnel outside of doctors and nurses who's responding to this pandemic. You have your medical orderlies, right? They are the ones who move patients within the department, getting them to x-rays, getting them to testing, tidying them, rolling them, turning them, moving them, right, where they need to be from transport to transport, from an area to another area. You have the laboratory techs who are working overnight 24-hour service to process many, many samples. And you look at the sample, you look at the numbers that were published today by the Ministry of Health being just 99 positive cases. That is a gross understatement of how much is actually positive. Because
I realize.
this weekend in SWRHA, our PCR machine was down and there were over 400 to 600 samples that were not processed, right?
Wow.
And these days, at least 50%, 40 to 50% of those are positive, right? So it's something that it's something that you have to, when you look at a statistic, I don't think that the general population is getting a really good idea as to how bad this is. Right now, our department is filled with patients and they have no way to go because Cuba is full, right? And Augustus Long is full. There's only one space, and there are 9 more patients waiting for the district health facility to come into us, for which we don't have space, right? And we can't make those space for those patients unless we get a positive or negative result. And our PCR machine is done. So you see, it's just a cascade, a vicious cycle
Yeah.
of bad
And
events going on.
people aren't listening to what the protocols are and what to do to prevent it. They're just acting like it's a normal day and everything, you know?
Yep.
That's really
Yeah.
sad. That's really sad.
And
But
another thing that has been very disappointing is the response of the media towards information that has not been verified properly. I think that the way how they put information out there is misleading the public a lot. So especially when it comes to vaccines and the general information. Usually in the medical conferences with the Prime Minister, they're asking the same questions. Why don't they just take up their media staff and personnel and come in the front lines and see what it is really
exactly,
like and
exactly,
see the struggles of the patients and their relatives, see how much persons are waiting to go to a facility, right? And these are things that are not published. These are things that they are not doing, and that's why the public is not grasping a better understanding of what the situation really is. As I'm
because
telling you,
they're
yeah,
seeing what happened in India and stuff, and they're thinking that's not going to happen in Trinidad at all.
but that
And
is slowly becoming.
it's a reality.
Yeah, it may not happen in our mass public, but it's getting there because along with India, we have been the country with the fifth highest surge worldwide in this particular wave, and that's something real alarming for a small country. And there are many reasons one may want to postulate as to why there's a surge, but at the end of the day, it comes down to the mere fact that we have not been observing proper public health regulations as outlined to us by the Ministry of Health, WHO, and PAO. Right? And that's why we are in the mess that we are in today. And this week, I expect a lot more deaths from COVID 19. And the most amount of deaths that will be reported will most likely be this week because the amount of patients that we are ventilating right now um, and the likelihood and how their x-rays are looking with the pneumonia that they have, it's looking horrible, man. Really, really horrible. And it takes a big risk when you're ventilating a patient to move that unstable patient from one facility to another facility because the mere transfer of a patient is creating even further instability in their condition. So you have to be very careful at weighing the options. But at the same time, you can't keep them there forever because you have other patients waiting to come in to use a ventilator.
Exactly.
So the challenge has been various, and those are some of the things that we have. Some other things is that primary healthcare, for example, they are overwhelmed as well. We are the emergency doctors, but then there is primary healthcare, where their job is
Mm.
different. Their job is to do contact tracing. Their job is to find out who was positive and who was in contact with those positive persons. And
Exactly.
I am sure at this point in time, there are many persons who are positive that they haven't even gotten to us yet, right, to do contact tracing for. And there are many persons who are positive who they haven't even contacted us yet, right?
Mm.
Such is the situation. So, some things to really bear in mind. The system is overwhelmed and overworked
So if
presently.
mm, all right. What advice you would have for a patient that
Yes, Shivam, you could go ahead.
yeah, what advice you would have for a patient who is at home and think that they have COVID-19? What would be the protocol for them to follow?
Well, first, before they think they have corona, they have to know what their symptoms are. If their symptoms are mild, like runny eyes and runny nose and itchy throat, sore throat, and cough, sneezing, chills, body aches, fevers, they really should get to a health facility that has the capacity to do testing so that they can get a test and go home and home quarantine, essentially, until primary healthcare will call them with the results. For those who are having more moderate to severe symptoms and don't know their COVID status,
Mm.
and they are feeling tired and weak and they are breathing fast and there are difficulty to get air, oxygen in and carbon dioxide out, and they're feeling weak and tired, they should really call an ambulance service or get to the hospital with some other local healthcare protocol ambulance service that could provide oxygen. And if they can't get oxygen and they don't live very far from the hospital and they want their relatives to bring them, that could also be an option, right? But seek medical attention. I think that's the underlying thing. And seeking medical attention, depending on the severity of your symptoms, doctors will test you nonetheless. Either way, you're getting tests. At this point in time in the pandemic, there is nobody that meets a case definition for a test or doesn't meet a case definition. With community spread, everybody getting tested. Hence the backlog of
Okay.
samples, hence the backlog of results as well. So seek medical attention. If you have mild symptoms, even moderate symptoms, doctors can treat you and give you some time and then allow you home with a quarantine order. If you have very moderate to severe symptoms that you need hospitalization, meaning that you need oxygen, you need ventilatory support, you need other positive pressure ventilation systems to support your respiratory system, then then you will have to be admitted to a hospital. And either way, you will still get a swab to know where exactly you're going. So seek medical attention, whether it be mild, moderate, or severe. Get a test done as early as possible. Follow your public health regulations and protocols. Proper masking, proper hand hygiene, physical distancing, as well as get vaccinated if you can, as early as possible.
It's really good advice. What we're gonna do, we're gonna take a small break and we'll come back. We'll talk more about the preventative measures and the different type of masking that it has, because a lot of persons are using, or cloth masks and surgical masks and all these little things. So we'll come back. We'll talk about that, and as well as some vitamin and supplements a lot of people are trying to use, saying that they could help boost their immune system and stuff like that. All right, so we're back. Nice. The preventative measures you were talking about, sanitizing your place and stuff like that. What do you advise to use? Because a lot of persons are purchasing items that may or may not contain alcohol and getting a little fooled by the mass, the mass hysteria out here.
Okay, so at the end of the day, soap and water is still the best thing out there for hand sanitizing. Um, However, it may not always be the most convenient thing when you're on the go. So hence the need for hand sanitizers. Hand sanitizers with an alcohol content of 70% or greater is recommended, right? But at the end of the day, washing your hands properly, washing your hands properly, getting between those creases on both sides, rubbing your thumb, don't forget your thumb, right? Rubbing the tips of your fingers, right? That is the most important thing, and covering your wrists as well. That's one of the most important things with soap and water. At least for 40 to 60 seconds, that is the gold standard they want to aim for. 20 seconds with hand sanitizer, it dries out really quickly, but it's still better. It's still better than nothing, especially when you're on the go.
Okay, okay, that's really good. And then people talk about Lysol and the aerosol sprays and stuff like that as well.
Well, I mean, Lysol and the aerosol sprays are really for surfaces, door handles, those areas, tabletops, where persons would have been, different persons at different times. So it's really for sanitizing surfaces, um,
Exactly.
but not sanitizing a person, right? So what you really
People
need,
take it and spray their hands with it. You
yeah,
see that already.
yeah, what you really need to do is wash your hands. Soap and water is still the best thing.
And the mask, right? I see a lot of persons using cloth mask. What's the best mask to use? Since I'm just talking about the different masks.
Well, one, the persons who wear masks with the valves in it, those little valves that is being the side of the mask, either here,
Mm,
definitely a no-no, right? Because those valves allow for anything from the outside, even large droplets and aerosols that are produced to get in through those valves into your respiratory system. So those masks with those valves and things that tell you that they have protection. The cloth mask, the simple cloth mask, is better than those, to be very
okay.
honest. So
Serious.
simple cloth masks are effective for the general population, right? The surgical mask is a little bit above that. And then the gold standard is the N95 mask that is used in high risk areas of exposure for healthcare workers, essentially, right? So where we have to be suctioning patients, putting a tube down their throat, giving them nebulizers. That's why we use the N95 mask to prevent that aerosol from coming on to these healthcare workers and going to others as well, right? But what is good for the general population where there are not so much of droplets and aerosolization? Simple surgical masks that is out there that have been selling for persons. Um, Now there are different colors, it's fancy, there are different cartoon characters on it, and even the cloth mask. Right? The cloth mask is as effective, but you have to wash your cloth mask. Right? You have to wash your cloth mask and sun it out properly. Right? So, and when you're wearing your mask, please cover your nose, cover your chin, cover your entire mouth. Do not hold it and talk to somebody, right? The whole purpose of the mask is to be over your mouth while you're speaking to somebody. If you have to increase the volume or the tone of your voice to reach that person, sure, but don't pull your mask and talk to them, right? That
Exactly.
doesn't make any sense at all, right? And don't pull the mask underneath your chin. That's not how you wear a mask. Especially you don't wear no mask at all, or if you're doing that, right? So cover your nose properly. This whole entire area here is supposed to be covered because this is where aerosols are generated and where they can get in, right? Washing your hands properly will prevent you from touching your face, your eyes, and all the surfaces that could allow for contact from non-living surfaces onto your side.
Okay, that makes sense. That's what I noticed in like a lot of Chinese groceries and smaller places. around 0.40, and I noticed a lot of persons just walking in just so they're not washing their hands and not sanitizing, just walking in, walking out because they say they sanitize already or do this already. And I don't think that's a good practice. People need to, make it more aware. I think when the things are already worse, so I don't know when they would listen. I don't know when people are going to listen at all. At all. It's really a saddening thing to see. And again, touching on the fact that a lot of persons are just buying vitamins and supplements and trying to, do different things and buy different products, saying that okay, it'll boost the immune system. What are your recommendations on that? On what are your views on buying these type of supplements?
To be honest, right? Out there, the this pandemic and the symptoms that it entails, really, there is no cure, there is no specific medication that is going to help you or that's going to cure you, to be very clear. Vitamins are pretty much supplements that actually helps you to it helps to fight off antioxidants and stuff in your body. At the end of the day, the best are the vitamin C. That's been proven the most to have benefit for those with flu-like symptoms. It reduces, it increases something called your interleukins, which helps to fight off inflammation and antioxidants in the body. So you really want your vitamin C. That's the most important. There are many different forms of it. There's the dispersible form, there is the one to drink, there's the one to swallow, right? There's even the one to suck, right? So I will restrict from name calling, but there are different preparations usually. And even there's the fruit form of it as well, in the form of oranges, Portugals, and cherry. West Indian cherry as the richest source of vitamins.
Yeah.
So actually, vitamin C is actually one of the best things that you can do. And the simple paracetamol will help with your fevers and your body aches. We try to resist from recommending things like ibuprofen, right? Um, Diclofenac, those types of drugs, because those drugs are not really prone towards yes, they might help with body pains and fevers and stuff, but sometimes they are also associated with a risk of bleeding, increased inflammation of the gut mucosa, something called gastritis, peptic ulcer disease. Because most times when you're ill, you don't have the appetite to eat anything, and you have to eat with these medications.
Exactly.
So simple paracetamol, vitamin C, lots of fluids, right? Stay away from others, physical distancing, proper masking, proper hand washing, right? And proper physical distancing.
Awesome, awesome. That's a really good recommendation because people are just spending all their money when they could use it to properly spend on something like fruits, vegetables, groceries for your house, all these little things. They're just spending the money on various vitamins. So that's some good advice. And I saw a lot of people discussing, especially today, about how the coronavirus is actually an airborne virus. Is that true?
Right, so a little misconception about how the
Mm-hmm.
article was again propagated by the media,
Media.
right? So TV6 actually had this publication by the CDC saying that the COVID-19 virus. I didn't see the article. I saw a little excerpt of it, right? I didn't see the view. Um, I didn't see the view from TV6, but I actually saw that it was a TV6 article. Now, what the CDC is saying, the CDC is saying that viruses, the coronavirus, is
Mm.
is not something that lives in the air. It is not something that grows in the air. It is something that's transmitted in the air because you produce respiratory droplets of it. So it uses the air as a medium to move through to reach others, and it can last up to minutes to hours in the air, depending on humidity, temperature, pressure, and pollutants in the air, right? And the density of the population as well. So, what the article from the CDC is saying, not that the virus lives in the air, but it's
Mm.
transmitted in the air, produced by droplets from our respiratory tract. I think that should be clear there, right?
Yeah.
So that is what the
Everybody.
That is what the article was saying, but it was taken a different part to mean, all right, let me fog up the place. You understand? Because, and that's not what it really tried to say. The article produced by the CDC, if you read it in depth, it talks about proper masking, proper hand washing techniques and hand sanitizing techniques and physical distancing. All right, and covering your nose and your sneeze, putting your nose in your elbow when you sneeze
Mm-hmm.
to prevent droplet aerosolization. So what
Exactly.
the
We are
article
taking it out
says,
of product.
yeah. So what
Mm-hmm.
the article says is not that the virus is airborne, but it is transmitted in the air produced by respiratory droplets from ourselves.
Okay, okay, that makes a lot of sense. And I saw someone posted a comment. They want to know what's your take on the face shields. A lot of people buying face shields as well.
Right. So I don't have any problem with face shields, but I think it should be used with a mask. To be very honest,
Mm.
a face shield just covers here, right around this area here. But there is space above, there is space below, and droplets will move with gravity down. So there is still the risk of exposure going into the respiratory tract. We use face shields in medicine to prevent high risk aerosolization, but we have to use it with a mask. All right.
Mm-hmm.
So face shields in and of itself does not give you as good protection as a mask alone. A mask is more than adequate to give you good protection. It's not going to give you the best protection wearing a face shield alone, right? Because remember, droplets can still come this way and it can still come this way, and even from around the sides.
Yeah. It must be the better thing to add
So
extra
provide
protection.
a tight seal, yeah. The mask provides a tight seal over the nose and the mouth and the chin.
That's really good. Do you have any advice for anybody that's watching currently? Any other advice, any other recommendation?
My advice will remain the same. My advice is um, stay at home, stay safe, practice proper masking, proper hand washing and hand sanitizing techniques, physical distancing, and get vaccinated when you can have the chance. I see somebody
Can
puts up.
you, yeah, you could talk about that?
Do you know if any persons who have taken the vaccine and have contracted COVID and
And
have contracted COVID and died, as per the headline on the young doctor that died? Right. So, um, good question. Nice that you brought it up. All right. Thanks for the question. The many parts to that question. One, the young doctor that died took the first dose of the vaccine. In order for you to be fully protected, you have to take the 2 doses and the 2 weeks after those 2 doses for your body to develop an immunity to fight off the bad effects of the virus. Secondly, yes, he died of what seemed to have been confirmed COVID-19 pneumonia effects, right? But I, you can't say that the vaccine is what caused the death, right? The COVID-19 is what causes that. As I was saying earlier, the vaccine reduces the incidence of hospitalization and bad effects of the virus. It doesn't prevent you from contracting COVID. What prevents you from contracting COVID is proper masking, hand washing, physical distancing. Right? Vaccination reduces hospitalization and the disease burden of COVID-19. All right, that is what it does. And in when one considers taking a vaccine, you can still get COVID 19. You can still have a swab done saying that you have COVID 19, but the vaccine is there to protect you if you're fully vaccinated. All right, if you're fully vaccinated, then
you're fully
it
vaccinated.
will protect you. Right.
Wow.
So there is a mathematical formula that determines how much of our population needs to be vaccinated. So that's a question that comes up regularly. How much people needs to be vaccinated in our country for us to develop an immunity within the country to prevent the COVID or to almost eradicate it and die it out? And the question to that is based on what the concept of herd immunity. And that's a concept which pretty much says if you vaccinate enough people, you're going to reduce the spread of the virus. Because when vaccination occurs, you reduce the transmissibility of the virus. As it stands, COVID-19 has a transmission rate of about 3, right? What that means is that one person can transmit the virus to 3 other persons. But it seems like with this strain, it's probably even higher, right? Um, so based
Is the
on that,
Brazilian one?
we can't say that the entire population is experiencing the Brazilian type right now, right? Yes, there are variants in our population. We know that there are more than one variant in our population, but it could also be a mutant variant that is not yet detected, right? So further testing has to be done by that in the University of the West Indies. But the
Okay.
thing about it, and
This person.
that's just a theory, right? There's no evidence as yet to say that happens. But what is important is that the percentage population, the amount of persons in our population that has to be vaccinated is 930,000 persons, right? Which is about 66% of our population, right?
Mm-hmm.
Based on the transmissibility of the virus. At present, Saturday gone, I didn't calculate for yesterday and today,
Mm.
only 0.06% of the population is vaccinated fully. So
Wow.
we have a long 66% to go again. And that is the whole purpose of getting people to vaccinate and getting people to be ready to get the vaccination out, to get the vaccination drive going. Where we want to see the lines is waiting for vaccine, not waiting for food and waiting for KFC and doubles and waiting to go in a cinema. Right? We want to see the lines for vaccine long, right?
I think this is true. If you already had the virus, is it possible to contract the virus a second time?
Yes, it is possible to get back the virus. As I said, the only way to prevent you from contracting, acquiring the virus in your respiratory tract is to wear a mask, wash your hands, and physical distance. Right? Remember, the viruses are produced and transmitted by aerosols. The only way to stop aerosolization is to wear your mask, wash your hands, physical distance, or to completely take an eraser and wipe out the nose of a human being and the mouth of a human being. It is physically impossible, right? So yes, it is still you're still able to contract the virus after having COVID, but the effects of the virus on your body will be significantly less. All right, that's the factor. Even and the same thing goes with the vaccine. Yes, you're still able to contract COVID-19 virus in your respiratory system after taking the vaccine, but it will not require you, what the evidence is showing, it will not require you from being hospitalized or having to need oxygen or being put on a ventilator, right? That is the purpose of the vaccine, is to reduce the disease burden of the virus.
To reduce the bad parts of the virus, essentially. It
Yeah.
wouldn't reach the point where your life on the line and all these things that happen. I understand that for a fact. That's really good. But what's your take on the virus itself? That you think it might mutate? I know for sure it's gonna be around for years to come. But do you think it will mutate to a point where the vaccines may stop working and all these things may stop working, and it will be to a point where, like how the Ebola outbreak was, and the vaccines just wasn't coming up to par and all these little things.
Well,
They would reach
at
that
this point in
devastation
time,
state.
at this point in time, the evidence shows that all the variants of the virus at present is covered by the vaccine. So the
Mm-hmm.
vaccine actually will cover all the variants. In order for the vaccine to not work, it has to be a totally new virus, completely. So if it mutates, remember I told you there was SARS-CoV-1, which was the SARS virus. There was MERS, and now there's SARS-CoV-2, all of which are coronaviruses of different types. For that to move from 1, 2 to 3, from one to 2, right? From SARS to MERS, there is some sort of change in the DNA of the virus, of the coronavirus. So if the virus mutates such an extent where it changes completely, then it's a totally different virus. And we have to worry about another
Mm-hmm.
disease. All right.
Another disease.
Yeah. But what is actually happening if you study these viruses is that the virus of the viruses are becoming more intelligent in a sense, if you want to put it like that. They are
Mm.
becoming, there are two things that determine the pandemic nature of a virus: its transmissibility and its mortality rate, right? And the types of, well, its mortality will be the types of persons that it affects, right? And it seems like viruses moving from SARS and MERS to COVID-19 is becoming more and more transmissible, meaning that more persons can be infected by it, and it's becoming more and more uh, increasing in mortality, meaning more persons are dying from it.
Wow.
So what one can say as time goes by, maybe we will come to a point in our lives where a virus will develop that could probably wipe out all of humanity, right? And philanthropist Bill Gates once said, you don't have to worry about the atomic warfare and the atomic missile. You have to worry about the microbiological warfare. That's the more dangerous warfare that is out.
Yeah. I think Stephen Hawking had predicted a virus like this was gonna come as well before he sadly passed away. So it's crazy to think about. This is the way that a virus caused the whole world to shut down in a way. That's just amazing. I don't know what to say about that. But thank you very much for being here tonight and sharing this information. I'm sure this was very informative for a lot of persons. And I want to congratulate you as well on the Global Peace Ambassador. And now seeing that here. Somebody now tag me in this. So congratulations. And I think we could probably do another discussion like this coming down the line. I think it's really nice. And I want to get more people to come on to ask questions and all these little things. But thank you very much again, Dr. Sookbir. And I hope you have an
Is there
awesome night.
any is there any questions that persons put that I didn't
Exactly.
answer?
Anybody
Mine is
have any questions? You can comment them right now. We're doing a little Q&A now. Thank you both. Stay safe, Doc.
thanks, Mary. You stay safe as well.
Um,
I think I tried to answer all
Vidya
the questions.
Vidyashree said to say hi to you. I don't know why it's
Hi.
not showing up. If anyone has any comments, you can post them now.
Anybody have any questions, queries, or concerns? Yeah, man, keep on. No problem.
Very
Thanks very much.
informative. You look at one too. Okay, I think. Oh, here we go. What natural remedies would you recommend the people home to try?
I would say anything rich in vitamin C, right? Because at the end of the day, that
Mm-hmm.
helps the most. Your fruits and your vegetables rich in vitamin C, whether it be a West Indian cherry, uh,
Mm-hmm.
whether it be a West Indian cherry, whether it be your oranges, your Portugals, those things will help. Vitamin C has been the only thing that seems to have some sort of adjunct to your immunity as it fights off the virus. And lots of fluids, of
How
course,
long?
water, coconut water,
Mm-hmm. How long
Rishma.
after you can? Rishma,
Vaccinate
yeah.
if you was tested positive before.
Mm-hmm.
That's time is not a factor in vaccinating if you were tested positive before. What is important is symptoms. If you have no symptoms, so if you were tested positive for about a week ago and you have no symptoms, right, up to 2 weeks after you can get vaccinated.
Okay, okay.
Once you're not symptomatic, right, you really still need the vaccine. The vaccine again is like a way your body will recognize the COVID virus as not being something totally foreign and prevent an overwhelming response to allow you to be hospitalized, right? So what you could do, if a person is tested positive and they do their 14-day quarantine, up to 2 weeks after, they can still have their vaccine. They can have their vaccine after 2 weeks. For a person who has diabetes from Lori laws, For a person who has diabetes or even asthma, how would the vaccine work for them? Because I am not hearing much being said on that. Sure, no problem. Thanks for your question, Lori. For a person who has diabetes or asthma, the vaccine works the same as it works for normal people, right? What the vaccine does, it introduces components of the virus into your body so that your body can recognize those components as being that of the COVID 19 virus and develop immunity towards those particular particles. So much so that when the actual virus comes into your body, right, it does not, right, cause the bad pneumonia that is associated with the virus that can lead to death, and it doesn't allow hospitalization. Yes, you can still get a little fever, still get a little flu with it, even being vaccinated if you're asthmatic or if you're having diabetes, but it will prevent you from being hospitalized, needing oxygen or being on a ventilator. So the vaccine for the diabetic and asthmatic persons works the same way, right? It works the same way. It has been even tested on diabetics and asthmatics before it was deemed as safe and efficacious for the population to use. And the outcomes were really good for diabetics and asthmatics, right? But thanks for asking that question. Not many people ask about that question. And that's something that has to be said because a lot of our population is diabetic or asthmatic. And more importantly, the information is out there to say that the vaccine works for these type of population. It's just not people reaching out towards it to grasp it out.
Okay, okay.
So from Marie, do you think we should be worried about taking the AstraZeneca vaccine because of some states not using it? No, I don't think that you should worry about that because of some states not using it, right? The thing about it is that vaccines, you have to understand something about the vaccine war that is going on. To date, there are over 19 countries and 19 different companies producing vaccines for COVID 19, right? But vaccine is really a race between the rich countries. So, example, why we in Trinidad can't have access to the Pfizer BioNTech vaccine and the Moderna vaccine is because it's pretty much procured by larger, richer European Union and America and Canadian countries for the use in their population. Now, these vaccines have been pretty much studied in these type of populations that are 81% Caucasian, whereas the vaccine that we have, which is the AstraZeneca vaccine, have been studied in about 48 to 50 countries or more. And even the Sinopharm Beijing one that we're going to get has been more studied in our populations and persons of our genetics than the vaccines that are not available to us. So I don't think you should worry too much about it not being in other states, right? It's just a matter of choice by a country which one they want to choose, right? The WHO can only recommend that, do the necessary studies to say that this vaccine is safe and efficacious. Once a vaccine has a safety profile and an efficacious profile above 60%, it is safe and it is very good. And it can be used by a population to confer herd immunity. In the US, persons have to wait 3 months after being tested positive. Well, in the US, they don't use AstraZeneca vaccine. They use the Pfizer BioNTech vaccine. So it's a little different over there than it is here, right? Every population will have their protocols as per the vaccine that they use. So in America, they're using Pfizer, BioNTech, and Moderna vaccines. So it will be a little bit different from us here. The vaccine that they use over there are mRNA vaccines, and they are not viral particle vaccines. So they are different in chemical composition, right? And they are different in how they work. So the time recommended after positive testing and vaccine will be different, of course. After getting a positive result without symptoms, what would you advise a person to do? I would advise the person to home quarantine for 14 days and a retest after 14 days to prove that they are negative, Once they are negative, they can go about doing their normal stuff.
Mm.
Those asthmatics and persons with kidney problems have any aspect that should be any complications, or do they need to see a doctor before taking the vaccine? So usually they do. So far, the studies have not shown complications for persons with asthmatics and kidney problems. I have had persons who are fully vaccinated, even some of my colleagues who are asthmatics are fully vaccinated, and they had no issues after taking the vaccines. But if you are not sure, it's always advisable to talk to your doctor before you take the vaccine. All right. Even if you have any other medical condition and you want to take the vaccine, talk to your doctor. He can guide you appropriately on a case-to-case patient doctor um, basis. It's difficult to generalize each patient to a vaccine because every patient presents differently. So if you're not sure
Mm.
about a case, talk to your doctor. I got my vaccine within the last few days. I developed coughing and sore throat. That's normal, right? You can develop symptoms, which is what we spoke about earlier on. Those are some of the symptoms that you can develop. Thanks for sharing. Um, those are some of the symptoms that you can look out for. Would you recommend taking the vaccine? I would. I definitely would recommend taking the vaccine. I myself have taken it. And I think, as I said, the vaccine doesn't prevent you from getting COVID. It prevents hospitalization and the bad effects of COVID. I got my vaccine within the last few days. I developed coughing and sore throat today. I'm a bit worried. Is this normal?
Normal.
That is normal. The symptoms can last up to 5 to 7 days. Use your vitamin C, use your little strepsils, and that can help. Persons with kidney complications, will the vaccine have any impact or cause any allergic reaction? So far, nobody with kidney complications who have taken the vaccine that I have known have had no complications or allergies. All right.
Okay, question here.
What is causing the clotting from getting the vaccine? Any truth to that? No truth to that. No truth to that. Right? So that is a
False.
lot of. So there is a condition associated with the AstraZeneca vaccine that is very rare, and it does not seem that our population has the genetic predisposition to it as yet or at all. Right? It's called VIP, vaccine induced pro-thrombotic induced thrombocytopenia. Right? What actually happens is that the vaccine, in those cases, who are persons with genetically disposed, is that they develop the risk of low platelets, the ability to clot faster. So far, there are no reported cases in Trinidad and Tobago of that happening. About a week and a half, 2 weeks ago, a radio announcer died of a heart attack, and there was some false publication about him having taken the vaccine. Afterwards, the relative confirmed that he did not take the vaccine. So one could lay that to rest. The other thing is that there was a gentleman who had died in San Fernando General Hospital. No, he didn't have, yes, he had taken the vaccine, but he was having symptoms of his clotting problem a week prior. So you can't say that the vaccine caused it when he didn't have symptoms of it before. All right. Now, the thing about clotting is that there's a one in a million risk of developing a clot if you take the AstraZeneca vaccine. Right? But there is a 16.5% chance that if you get COVID and you get a bad pneumonia, you will get a clot and could die from it. You can get a stroke from it, you can get a heart attack, or you can get a clot in your lungs. So at the end of the day, it comes down to preventing that bad pneumonia by taking the vaccine. If you develop symptoms of swelling in your leg or shortness of breath after taking the vaccines, see a healthcare provider. That problem can be easily solved by giving you appropriate medication to resolve those issues. Is the vaccine safe for women to use with polycystic ovarian syndrome? The answer is yes. It is safe to use. Studies have been done abroad on women with different gynae pathology, of which polycystic ovarian syndrome was one of them, and it has been safe. It is not, however, safe for pregnant and breastfeeding women to use the vaccines. The studies have not been done on them, nor has it shown.
That's a good.
Right. So, Kenneth Balgobin, quick question: do you know any person? Do you know how
How?
persons get the vaccine? Yes. So, on the Ministry of Health website, there are numbers and there are WhatsApp numbers that you can text or message the different regional health authorities to set up an appointment for your vaccine. Right. I will send Shiva a presentation that has all the different numbers and all the different
Mhm.
locations for the vaccine so that he can post it up for you guys to see. Well,
Yeah,
what
that'd be the
actually
best thing.
happens, what happens is that in South there is Laramie Health Center, there is
Point
Princess,
fortune.
there is Point Fortin, there is Princeton, there is Siparia. Then there is a mass vaccination site at SAPA, Southern Academy of Performing Arts, that takes working personnel for vaccines. But use the numbers, call, make your appointments via WhatsApp or via phone calls. The challenging thing is that a lot of persons are calling to make appointments. So if you don't get through once, twice, or three times in a week, keep calling until you get your appointment. Okay?
That's good. That's good. I think the information has to be more out there for persons to access because I have a lot of older persons as well. They don't know how to go on the websites and all these little things. So I think this will be the better thing. I think we have another question. Yeah. Or can you send it to me? Yeah, we'll send it to you, Julie. That's no problem. And again, we're on lockdown. So, everyone should have the time to go and do this.
So
So much
Shivam, I
person.
just sent you the presentation on WhatsApp there. You can share it.
Mm.
You can share it on Facebook. It's a presentation that I had done for the public on myths about the COVID-19 vaccines, right?
Mm.
And the different type available to us, the side effects, and every question that you guys are pretty much asking. What are the myths about it, and what are the different things about it, and where you can go and get the vaccine, and the numbers available. So
Mm.
you guys can
That's
access that
nice.
via the media and the social media platform and use it to make your phone calls and get your vaccines.
Okay, okay. That's really awesome. Does anyone else has any questions for the doctor? Dr. Sookbir? Let me see. This is really informative. I think a lot of people would benefit from this. This is really nice. The public needs to get more information, so I believe doctors should come on more often. Yes, at your own show.
Yeah, but
It's really nice.
who going to help the persons on the front line dying
That's
of
what
pneumonia?
exactly.
I gladly
If the
accept.
media, the media
I
should be
guess
pushing out this information better.
I guess that's the thing. I don't think that, to be very honest and very fair to the government, and I'm not prone to any particular party or whatever. I think that the CMOH and the
Hmm.
Prime Minister's office is doing a good job to be very transparent about information out there to the public. And I think that they have done a very good job with
Hmm.
respect to that. But the media itself has not pioneered proper information. They have pioneered more misinformation. And that has sorely disappointed us as medical professionals because a lot of persons are coming and asking questions that are not appropriate because they hear this on news and whatever. Is it for someone
Yes.
who had cancer? I didn't get the first part of the question.
They didn't put that post, they just posted that. So I think, I'm not sure what they're trying to say. Leela,
Leela,
if you could put,
yeah, ask back your question
yeah,
properly.
need to share the live and inform people. It's public, so you can share it anytime you want. And it'll be up after this finishes, so you can keep sharing it. The public will build more confidence. So,
I
do you
agree.
think only 22? Only 22? Do you think the country gonna start back? I doubt. I think this is gonna extend.
Uh, To be honest, it's going to be a real hit and run. I'm going to be very close. I don't know. We are behind on testing, right? At the end of this week, I could probably better answer that question. Um, we are behind on testing. Our hospitals are full and overwhelmed. The 23rd is not very far off. It's probably just 13 days away, 2 weeks away. So um, I really can't say that with any certainty. But if I have, but if I'm uncertain about it, it means more likely that it will be extended. A lot of people have fear about taking the vaccine. I hope now after this live they will think otherwise. I hope so too, Kenneth. And I hope you can encourage others to take the vaccine as well. And I'm happy that you asked the questions that you did. You asked some really good questions. Everybody did, and I appreciated the feedback. And I hope that you guys can spread the good news about taking the vaccine, about channeling this public health cause, because you are the ones who are really responsible for the healthcare of your family, your friends, and your relatives. If you take the vaccine and if you take the vaccine and you if you take the vaccine and you become fully vaccinated, you protect others around you from getting a bad pneumonia. So you do your part and pray and hope and encourage others to do their part as well. But at the end of the day, guys, what is going to prevent us from getting coronavirus is anybody see it. Proper masking, proper hand washing, physical distancing. Getting the vaccine is real important, but it reduces the disease burden of the virus. Is it safe for someone to take the vaccination who had cancer? Well, meaning that the person had cancer and is in remission, yes, it is safe for them to take the vaccine. But before you take the vaccine, I would ask you to consult with your oncologist or your cancer doctor, and he or she can do and give you better information as towards that, because it will depend a lot on your blood markers as well, and he or she will have that information to guide you accordingly. So, as again, in those situations, those delicate situations, consult your general practitioner. If you have heart disease, if you have a clotting disorder, if you have a bleeding disorder, sickle cell disease, and you want to know if you can take the vaccine, by all means, talk to your private doctors and they can guide you, or talk to your general practitioners and they can tell you, or talk to any doctors. It should extend. We are not at a good place at this time. I agreed, Susan Mahan.
That's true.
Is
The
there a
difference within the
difference with
vaccine.
vaccine from China and US? Yes, because the type of vaccine produced in China and US, as I told you before, they target different parts of the virus. So a virus is a particle, but a particle is made up of different parts. For example, let us look at it from this perspective. My name is Jonathan, right? And when I walk into a room, persons will know Jonathan by the way how, by his height, by the color of his skin, by the way that he walks and the way that he speaks. Just a few characteristics. Similar for viruses. When they enter a system, they are known to that system or recognized by that system by the way that they look, by the way that they replicate and do certain functions. So what vaccines do is that they take certain features of those viruses or certain appearances of those viruses and present it on a platter to the body's immune system to recognize and that virus and build antibodies or policemen of the body to when that foreign body enters into the body, when that virus fully enters into the body, they can deal with it. They can coordinate up and lock it up and deal with it in a manner that does not cause a lot of collateral damage.
Kenneth. There's no problem, Kenneth, at all. This is here for everyone to get some good information, you know. That's why I'm trying to do lives with various medical practitioners with different persons in that aspect. So you get the knowledge out there. Not only within the medical field, but like financial advisory and all these little things. Hi, Ivan. What about the schools? Should children be going to school? Is that safe?
No. No, not right now. Not in this wave. Definitely not in this wave. Because we are seeing younger persons becoming more and more ill. And so far, we have not seen severe cases of bad pneumonias as a result of COVID 19 in children. Yes, children have gotten COVID 19, but not bad
Mhm.
pneumonia. And I think one of the reasons for that is pretty much that school has been out. And I think if we can protect our children, and the Prime Minister said it very explicitly on Friday, the children is what he will place most priority and most emphasis on. And I think if he has to lock school off for until the end of the year to and ensure that the population is properly vaccinated and that we've overcome this wave and we know that what we have to do to make that decision for the new year, I think he should. But right now, if this surge of pandemic wasn't so bad, I think he would have
Mhm.
considered opening in September. But because of the effects of it, I don't think, I think his advisors and all his medical advisors will be telling him to do the opposite. For someone
Exactly.
who contracted and tested positive for COVID 19 virus, are you somewhat immune to contracting the virus again? Does your body now have antibodies to the virus? Roger, excellent question. The answer to your question is yes. They have your body will have some antibodies to it, but you still need to vaccinate to get full coverage. We haven't fully understood the natural immunity that you get after contracting COVID 19 virus. All right. So, what is important is that you get vaccinated to get the appropriate coverage, right? Because everybody are exposed to COVID 19 in different ways. So, somebody might have mild symptoms, moderate, or severe, right? It depends on the volume of viral particles that they are exposed to as well, right? So that will generate the necessary immune response. So it is still advisable to get vaccinated because your body's natural immunity is uncertain of the amount of antibodies it has to produce by a certain type and volume of exposure. Is the vaccine recommended for kids? Not the ones that we have right now. Vaccine for kids are presently undergoing trials. Vaccine for kids are not safe as yet, and it has not shown efficacy as yet. But there are trials that are ongoing at present. But the ones that we have are not for children. The ones that we have are for adults 18 years and over.
So says good night, good job. Hmm. Anyone else have any questions before we end the live? Oh, and I see it have a lot of Sahara dust in the air of recent as well for the next 2 weeks, I believe. It can cause some allergies of persons.
Signs of the times.
Exactly. See nobody posting any questions. Any questions at all, guys, or we're gonna cut it there?
So before I go, I just want to say that
Mhm.
this pandemic has affected a lot of persons in different ways. And it is difficult for me to imagine uh, how it has affected you, the listener.
Hmm.
I don't know everyone, and I don't know what job you do, or the size of your family, or what is your source of income. But I am sure that it has affected your income in some way or the other. And in that regard, I know it's real challenging out there. Um, and it's difficult. It's really, really difficult. Some persons don't have a job. Some persons have been released from jobs. Some persons are working half of their job force for the month. Their salaries are cut. I know it is really, really difficult. But the night is always darkest before the dawn. So
Mhm.
just give it some time, do the right things. At the end of the day, nothing can repay human life, right? If you become ill with COVID and you develop a bad pneumonia, it could be the end of your life. And if you're the sole breadwinner of your home, no one can provide for yours. Stay safe, stay home, properly wear your mask, properly wash your hands and sanitize properly. Physical distancing is important, right? And more importantly, if you can get the vaccine, please do so. Vaccinate as much as you can. All right. Good night, everyone. Please stay safe out there.
So,
Right? We don't mind in the front
mm,
lines doing what we're doing. That is our job. Right? But as the Prime Minister also rightly said, it takes 5 to 6 years to generate one doctor. But it takes just a moment of negligence for somebody to acquire this virus and become very sick and die from it. Right? And the amount of resources that that one person can use up. And that 5 to 6 years at doctor training that that one doctor or nurse or paramedic or EMT or medical orderly or persons, our ancillary staff who help with cleaning, our security staff, our laboratory technicians and radiographic technicians, all of those persons, all that training that they would have done for many years would just go down to the drain when they get it. Right? We have lost a lot of our colleagues. Even today, I had a medical orderly who got positive. We had a doctor who died over the weekend, a nurse who died last week. So it is all that energy that was diverted into training and saving. We ourselves are becoming part of the statistic as well. So and we expected that because and that is a risk that we took upon ourselves gladly. But do your part as human
mm.
beings to curb the spread of this pandemic. Be responsible and be safe. Stay at home.
All right. Thank you very much, and I salute you guys, especially all the health workers, especially you, Dr. Sookbir. I really appreciate this, and this was very informative for persons. And I will be posting the stuff they sent me as we finish with this live. All right. So thank you. Have a good night, and please be safe out there. Good night.